My name is Sarah Jockin. I practice at Lake Park Dental in Tampa, Florida. I graduated in 2009, and that was right after the economic downturn, so I tried to buy a practice and was not able to do it. So I associated with a different DSO and didn't have the very best experience, so after a year I left. And I opened the practice that I really wanted to build myself, that I would want to go to myself. So it was a high-tech practice with really convenient, beautiful ops and good hours, and somewhere where I would like to go. High emphasis on good customer service, and of course excellence in clinical dentistry was important to me too. I took a lot of continuing education and I invested in technology. I became really proficient with implants and enjoyed doing that. And after a while I realized practicing by myself wasn't going to work for me because I was really missing the exchange I had with other dentists in dental school and at the corporate office where I was at before. So I decided to expand and hire an associate, and that turned into two, and then we got our in-house lab, so we grew tremendously. And while I loved that practice, the burden of the debt that I had accumulated, of managing a team of 29 ladies, it really weighed heavy on me after a while. And I started speaking and couldn't be in the practice as much as I wanted to be. So it became more and more of a burden to run the office and do the back office stuff, not the clinical dentistry. It's just everything around the clinical dentistry. Equipment failures, team disputes, all the things that you have to deal with when you own your own private dental practice. So I was still under the understanding that all DSOs are the same. And my friend and mentor, Larry Lieberman, he opened my eyes to that they're not, and he had affiliated with Heartland. So I really started looking at different DSOs. I looked at PDS, I looked at NADG and Heartland. And Heartland has the best opportunities for me as a dentist, because what I noticed, not only did they have the best purchasing power, but they also were able to guarantee me that I had complete clinical autonomy. That was really important to me because I didn't want to change my patient care. I still wanted to do the same high-end, very patient-focused dentistry that I had been practicing. A month and a half, we made the transition, which was actually really smooth. I was surprised because I expected a whole bunch of hiccups. What has surprised me is that I'm getting paid a lot more for the same procedures on the same patients with the same insurance plans, because Heartland has that negotiating power that I didn't have as a solo doctor. I also get my materials and things that I need to buy from manufacturers at a much lower cost, so my profitability has gone up tremendously, which means my team is now making a higher bonus, so everybody is becoming more profitable, which is huge. So when I made the decision personally to affiliate with Heartland, I was a little concerned about telling my team. That's because there are some myths out there about DSOs. The first myth is that all DSOs are the same, which is not true. There's also a myth that you will lose clinical autonomy and they will make you do procedures you don't want, or they won't let you do procedures that you want to do, which is, nothing could be further from the truth. Everybody at Heartland highly encourages, and there's no other way than to let the doctor diagnose how they want to diagnose and treat how they and the patient decide that it needs to be treated. And another myth was that I would have to take certain insurance plans, and I just don't. So the transition was successful in that I didn't lose a single team member. Everybody came on board and is really on board now. From a work-life balance standpoint, it is fantastic to be part of a big group. I travel a lot, I speak, and I'm out of town, and I know that my patients are taken care of. And when I get home, I can just relax and I can take time off and be okay. I make sure that my production is still good for the month, but it's not about having to be there at all times to manage things and to lead the whole team. I still lead my team as a doctor in the office, of course, because I'm still in charge of clinical care, but I don't have to feel responsible for the whole operation every day when the office is open. So it really gives me a timeout when I'm gone.